This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Sunday morning at 8 o'clock, that means it's time. It's time again for Health Watch, right here on Talk Radio 1210 WPHT. Good morning. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We discuss here on the program ways to improve your quality of life, and Dr. Molly will tell us how to do it. Here on the program, it's Health Watch, and that's where we are today. 855-839-1210 is the number here in the studio. If you have a question at any time for Dr. Molly or a medical challenge, 855-839-1210 is the number here in the studio. And a pleasant good morning, Dr. Molly.
Hey, John, it's good to be back with you, of course. Of course, I see you twice a week,
That's right.
Which helps make my day, you know, and I hope it helps you make your week, buddy.
Yeah, that's true. I mean, without that.
God bless you, John. That's all I can say.
So tell us, we usually start the show by explaining what it is you do, and every week you have to explain it because people still don't know.
Every week I get the call, like, what is it that you really do over there in Marlton, New Jersey? Well, the bottom line is I have a licensed primary care facility, which means we can do anything that any general outpatient setting can do. We can order prescriptions for you, and we have prescriptions in-house if you need it. We can order radiology. We can get you over to specialists. I have a whole network of other professionals that I work with so that we can actually help a patient resolve some of their issues. But the big difference is that we believe in God's ingredients. And we believe that if there's a way to effectuate the change for the patient, using pharmaceuticals, that's fine. But can we use the least amount of pharmaceutical necessary to effectuate that change, thereby eliminating some of the side effects and some of the damage that the side effects do to the patient while undergoing treatment?
And are there any side effects to what you do?
Sure. If someone has an allergy to a particular substance, we know that this affects blood sugar, that's for sure. And as a result, we have crackers and things like that for people to snack on. But we've been doing this, John, for 27 years. I think, and lovely Linda will have to correct me since she's been with me all that time, I think we're going on maybe our 28th year, but I'm not quite sure, in October. And I have to say, in all that time, John, we've never had one life-threatening issue. We have had somebody who maybe doesn't like needles and that type of thing. But I got to tell you, bottom line is medical hydration is an absolute bona fide medical treatment.
Which leads to the question, and everybody asks this, does it work?
Well, I can only tell you that if using the proper constituents, meaning the particular substances that are in these natural products that I'm talking about, which are vitamins, minerals, amino acids, herbals, even homeopathics, if you're using the right constituent, I'm always looking at the underlying science of it. What is it in there that will work for this particular patient for his or her particular problem? And, you know, John, lots of people come to me with medical mystery. There it is, medical mystery, and I like to call us desperation medicine because they've been to the hospital, they've been to the urgent care, they've been everywhere, and they're not sure what's going on, but something is. And my biggest issue is I like people to come to me before it's really, really serious, which, you know, many times they don't. You see my clinic.
Yes.
Right?
It's a shame.
And it's a shame. But again, it's then we have to really get into their their particular archaeology. And when I say archaeology, I'm talking about the archaeology of their particular challenge and where they've been, and look at the reports, the medical findings, and see if we can put our finger on what's going on for a particular patient.
The archaeology and the science behind your protocols,
yes,
which is the
essence,
the ingredients in the hydration
yeah.
bag.
Yeah.
How do you determine that?
Everybody's different. You know, many times, John, I'm using combination therapy. We use traditional drugs. And by the way, hydration, medical hydration has been around since the 50s, maybe even before. I think from Hippocrates, maybe. You know, let your food be your medicine, and vice versa. There's the thing, John. It's a question of looking at this, figuring out what's going on for a particular patient, and then putting together the particular protocol for that patient. Look, I want to say this right up front. It's not holy water. We've talked about this many times. We know there are traditional recipes out there for IV therapy, whether that's given with the pharmaceutical or nutraceutical. You know, many times you go into the emergency room, you don't feel well, they'll give you a banana bag. That's what it's called. You go to the spas, that's what you're going to get, a banana bag. That's the traditional recipe that's been used for many years. That's a great basic recipe. I'm not telling anybody don't go to the spa when you feel like you're a little fatigued, whatever. That's great. But when you have a medical challenge, you need to be in a medical hydration place.
And that's what you are.
That's what we do.
Basically.
That's what we do. And we look for what's the underlying cause of a particular challenge. And believe it or not, sometimes it takes time, John. You just don't walk in and, you know, we have x-ray eyes, man. We sit down, we discuss the case. Many times I'm on the phone with my doctors. If they're in, you know, they're in the facility, I'll talk to them about the case. And I have wonderful registered nurses, and we put together a protocol that we use for a particular challenge for a particular patient.
And if you have, I would say, over 600 protocols.
Yeah, very.
So the likelihood that you have something
for a
condition is high.
And I'll tell you, more and more I'm seeing the chronic conditions, which is one of the things I want to talk about today. And what happens is because they wait so long to come in, they're really debilitated. So that, my friend, is where a lot of the nutritional issues come in. It's utilizing the medical piece and the nutritional piece together that helps a patient really move them through their continuum of care.
How do you do that, though? Marry the nutritional and the medical.
Well, you want to look at what's the patient is presenting. You want to say, okay, what do we have in our black bag that we use traditionally for this presentation? How can we enhance that? Are there natural substances that have certain constituents that work on a particular system or in a particular way that can enhance the medical portion of this? And many, many times, John, there are. Listen, before there was Big Pharma, there was God. He put this out here. You know, come on. I'm a big believer in God's ingredients because he put them here for a reason.
Have you determined, or I guess it's hard, but maybe tell people what conditions work best as far as you're concerned?
Well, we're going to talk a lot about many conditions because I think there's a basic underlying problem for most conditions. And I think we're going to talk about that. I think it's important, you always bring to my attention, Dr. Molly, you're always giving people the free consult. Yeah, it's supposed to be 15 minutes or 20 minutes.
It never is.
It can't be because most times people come into me and they're in trouble and I want to try to pull out information. And then I need to really move ahead and gather information. In other words, you come in, you tell me what's going on. Can I give you some immediate relief? The answer is yes. But the idea is I don't want our particular protocols or our particular treatment plans or what we do in terms of your quality of life. I'm looking at your quality of life in the long run. We're looking at the long haul, and that's really important, John, and that really starts with the free consultation.
And after the break, we're going to go over the initial consultation and what you do and how you do it and how it helps people, because I know you're concerned a lot of times people wait till the very last minute and they contact you.
Stage 4 cancers, I'm seeing a lot of them.
And you know, I mean, you're good, but you're not a miracle worker.
No, and I don't profess to be, because, again, we're looking at your quality of life. You know, most people drag themselves into me, right?
Yes.
And the idea is, okay, so you can get a little boost. The idea is, how do we effectuate the change so that you can have a permanent type of solution to improve your quality of life? That's what we're all about.
And that's what you're trying to do, is
Absolutely.
effectuate change.
Absolutely. And that's the bottom line. With that, then, armed with that kind of information we can get initially, and then as a patient starts their protocol. And John, you know I'm out there on that floor talking to everybody in that chair, because I want to meet patients where they are so that we can make the changes necessary for their continuum care. And I want to focus in quality of life. I found that, you know, longevity is a wonderful thing. Longevity is great, but if you have longevity without quality, man, that is like having a life sentence.
Yes, it is.
Okay?
Yes,
It's a
it is.
bad deal.
How many treatments can people expect when they get started?
Man, that is a loaded question. We can see some changes in lots of people within the first 5 to 10 weeks, depending on what they're coming in for and how many times a week they come in. But to really effectuate change for lots of these conditions that I'm going to be talking about in the next couple segments, you really need somewhere between 15 weeks to 30 weeks to really effectuate that change and continue it. And in some cases, particularly cases that have viral components, bacterial components, chronic components, and maybe cases that have no real diagnosis to them, but we know something is going on based on a lot of the testing, it may take longer.
We are coming up on our first break of the morning. The program is Health Watch. We are here every Sunday, 8 till 9 on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is our number here in the studio. We always tell you, call early so you don't get shut out. 855-839-1210 if you have a question or a medical challenge you want to run by Dr. Molly. I'm your host, John DeMasi. Dr. Molly and I return with more of today's Health Watch after these words. Back here on Health Watch, every operator is standing by right now at Innovative Medical Associates, and the number 856-489-0505. It's 856-489-0505. You can call and set up the initial consultation with Dr. Molly. It is complimentary, so it doesn't cost you anything, and that's really what you want. 856-489-0505, and the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. Health Watch is the program every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. We are going to the phones. We're going to talk to Lance in New Egypt, New Jersey. Lance, good morning. You're on with Dr. Molly.
Hey, Lance.
Good morning. I'm so glad I was able to get into you this morning. You know what I'm going to talk about.
Go ahead, Lance.
That's right. Molly wanted me to unload. Listen, I just want to tell you, anything I have to say, don't blame Dr. Molly. I just brought it up to her. You need to hear this. I'm a veteran of this great nation, and I'm 77 years old. So people wonder why I do. People often tell me I'm crazy. Well, they're absolutely right. I am crazy. And when I put my uniform down, I did not put my oath down. Everybody that's listening to this show right now can be rest assured that my life is still pledged for your life. And that's why I'm calling.
God bless you.
There are people right now that are known as biodocs. The biodocs are doctors and researchers that are mostly supported by misguided private industries and the government. What biodocs are doing, they have a target. They have a three-pronged target right now, which is farming, food
Yes.
God was there long before everybody, and he will be there long after everybody. And what happens is the biodocs, along with the encouragement of the FDA and the Pfizer, Moderna, and Roche, and all the other drug companies, which is a country club, they are prioritizing right now. Believe it or not, they are prioritizing all of God's ingredients. Anything, vitamins, minerals, enzymes, or whatever you think, they're prioritizing this, and they're making copycats in the lab.
You bet
So whatever
they are.
you can name, any vitamin, they're making copycats that are floating in a pile of chemicals in the laboratory. Then you say, well, why do they want to do this? I remember, I know these guys. I spent time with them in their labs. And what they'll do is they'll make a copycat. They're going to fast track it through the FDA. Then they're going to turn it over to the drug companies. Well, what does that mean? Now the drug companies will have an approved version of a godly ingredient, and they're going to tell you how to manufacture it, retail it in any form, whether it be a capsule, a pill, a powder, or a liquid. And then they're going to say, oh, well, wait a minute. This will be the only thing you can provide to people because it's approved by the FDA. It is more sterile. It has a lower carbon footprint. And don't even get me started on that. However, at the end of the day, it's going to be nearly impossible with their way and their directives. Remember, they don't need law to do this. They can issue directives that said this is the only formulation that you can have. And what will happen, what they're making, as a way that the biodocs explain, they say they're going to have traces of the natural ingredient in the chemical compound so that they can call it natural.
Right.
And they're going to tell you can't have the godly ingredient because they say that's contaminated by the carbon footprint. And what will happen is they'll go to the health food, the nutrient companies and say, here's the formula. They'll go to the health food store, and you'll go in, you'll see all the regular things like the Nature's Ways and the Solgars and everything else, but it's going to be their formula in the bottle. And then they'll go to Dr. Molly, they'll say, that's all right, the infusion's fine, but this is the formula. You see, we don't want you to go out of business, we just want you to cut your throat. You see, and that's what they're doing. That's when you talk about desperation medicine. This is they're producing the desperation medicine in the laboratory, and they want you to pay for it.
And
when you say don't get angry, what get angry? I'm a combat vet. I know the enemy when I see it. And the thing is that and I'll leave you with this. Here's the red flags. In farming, they have a chemical they're developing chemical chemical things that they want all the farmers to spray in their crops. That's the first thing. Then you get into the food industry. They want to make all the chicken in the laboratory because the chickens are screwing up the economy, the environment. So they want you to. And right now, you go to any store. I don't care where you shop. Probably 20% of everything in the store where you shop now is already engineered. It's already engineered. And then you get to Dr. Molly and they want Dr. Molly to cut her throat. Because I'll tell you, here's a red flag. You got to watch it. The red flag is already out there, and you see it in cancer, cancer treatments. It's called immunotherapy. And they are not using anything that's godly in immunotherapy. All it is chemistry plus. You see, that's it. It's going in your system.
Lance, we appreciate your call.
Thanks a lot for the call,
I want to tell
Lance.
people what they can do. They've got to join the Alliance for Natural Health. You and I speak about it. We speak about it at the office. People really need to join. It costs nothing to join, and it gives us an update on lobbying. Thank you.
Thanks for the call, Lance.
And you know, I just want to say something to Lance for bringing this to our attention. Remember, our compounding pharmacists are being affected right now. because they have to use something called the pharmacopoeia, whatever, and it makes it difficult for them to get approved products. Things that were approved 5 years ago are no longer approved. Not because they haven't been around for 100 years, John, but because they have. And so it's an amazing time, and we have a lot to talk about on that level.
Yeah, what the point is, Big Pharma is really kind of getting into your territory. That's what he was saying.
Of course it is. And Big Pharma is buying up a lot of vitamin and other types of companies that have been around for a long time. And so it goes right into what I wanted to talk about today. So it's all good.
All right. 855-839-1210 is the number here in the studio. If you have a question for Dr. Molly or a medical challenge, 855-839-1210. We're coming up shortly on a break, but before that, we wanted to talk about the initial consultation.
Yes.
And why is it that people wait?
I don't know.
Rather than wait, the initial consultation doesn't cost anything, and you learn a lot.
Well, John, I think that the important thing is people may not quite know what's going on, or they may have gone to 4 or 5 different types of facilities, seen 4 or 5 other doctors, haven't been into a place, maybe have gone to one of the spas and got some vitamin C or whatever, and felt like things didn't work for them. So I want to urge people to know, don't give up. Come into a medical facility like ours, and we are a medical facility. I have 2 physicians. I have 2 physicians plus nurses, registered nurses, and let's talk about your challenge. Let's see if there's something we can do. Let's do the archaeology on your notes from other places and see if there's a way by which we may be able to improve your quality of life. And I think, that comes from the heart. That's all I can say.
And really, you do learn a lot about what you do.
Right there. And that's why it's important for people to really come in and do the free consult so that we can then tell them, look, this is the direction we might want to take you in. And I want feedback, and my docs want feedback. We need to hear from our patients. Listen, Lance is a patient. You know that people in the clinic, hey, you want to do a talk radio show sometime? Let's do it right from the clinic, right?
Yeah.
There'd be a whole lot to talk about at that point. So, John, I think the free consult's very important.
We are coming up on the halfway point of the show. Really, it's flying by today.
Today.
You know what we say, time flies when you're having fun. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. You have a question for Dr. Molly or a medical challenge you want to run by her, 855-839-1210. That's the number here in the studio, 855-839-1210. I'm your host, John DeMasi. We are both coming back with more of today's Health Watch after these words. We are back here on Health Watch, and again, operators standing by at Innovative Medical Associates, and they will be there well after we leave you at 9 o'clock this morning. 856-489-0505, that's the number. And we told you earlier the importance of the initial consultation, and that's really all you want to do is call and set that up with Dr. Molly, 856-489-0505, and the website, innovativemedicalassociates.com. A lot of good information on that. Innovativemedicalassociates.com is the website. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. 855-839-1210 is our number here in the studio. If you have a question or a medical challenge you want to run by Dr. Molly, feel free to call in, 855-839-1210. And we're going to start off by turning back the clock to 2004.
Yeah, because this is very interesting, folks. So February of 2004, a fiery article came out in Time magazine, and it really made the cover of Time magazine. It was called The Secret Killer. Well, the secret killer turns out to be inflammation, something Dr. Molly talks about repeatedly. inflammation. And think about this. 20 years ago, we found that scientists, and actually lots of the scientists were in a lot of the large institutions, that kind of thing here, but there was a lot of data going on in Europe, which is why I think Time picked it up. So one of the things we found is they were seeing significant correlation between immunology, defense mechanisms, which is our immune system. Interesting that Lance talked about immunotherapies, but our immune system, and inflammation as the silent killer, because we really hadn't developed all of the laboratory data yet to really help pinpoint inflammation and specific inflammation, like for cardiac or autoimmune and those kinds of things. So they knew that it was contributing to circulatory issues and the blood vessels, and they found that it was probably from low-grade infections, especially inflammation related to allergies, asthma, skin conditions, and some autoimmune. But it could be triggered by viruses. One of the things I want to talk about is, didn't we just come off of something called COVID?
Yeah.
Talk about inflammation. And during that time, there was a huge push, interestingly enough, a huge push for pharmaceutical companies to put out more what? What kind of drugs, John? Anti-inflammatory drugs, right? Because using them would really inflate the drug company's bottom line and also help people. I mean, there's a spot. We know that anti-inflammatory drugs are good for a short term. Now, 20 years later, we know that really they're not so good for the long term.
We have a call, Dr. Molly. We're going to pick that up in just a moment.
Okay.
But first, we're going to talk to Lewis in Elk County, Pennsylvania. Lewis, good morning. Welcome to Health Watch. You're on with Dr. Molly.
Hi,
Good
Lewis.
morning, Dr. Molly. Enjoy your program when we can get it. We're up here near Erie, PA.
God bless you.
We just want to tell you that Professor Roebuck, he suggests that we ought to change our farming tactics and go into organic farming by allowing the organic farmers to make like $400,000 or $500,000 a year without paying any taxes until they reach that plateau. And,
hey, Dr. Molly's
that
for
way
that.
We can shift the industry to get away from the glyphosate and the Roundups and all that incorporated in our food. And he also suggests that when you have intestinal problems, you take pills, the capsules from the pharmacy. You get blank capsules, and you take probiotic yogurt, and you fill them up, and you take, say, 20-25 a day over time.
Sure.
And that helps feed
helps
the
your
lower end
microbiome. Yes, very cool. Very
Yeah.
cool. Hey, Lewis, let me ask you this. You're not going to be endeared, to the FDA. Dr.
I don't care about the FDA, Dr.
Okay.
Molly.
God
But
bless
some of
you.
my family have been hit by the coronavirus pretty
Yes.
badly and have long-term virus situations. They're only
Yes.
20, 30 years old. It's crazy.
And you know what? That's what I'm talking about today. That inflammation, when you have something that triggers this, and unfortunately the response goes haywire, you got big problems, especially today, big problems. We see a lot of that. We really do in my clinic. And
Sure.
my docs can't do enough to help patients go through it. Lewis, this was a great call. Thank you. And,
Thank you, Dr. Molly.
Thank
God
you,
bless
Lewis.
you, Lewis.
Thanks for the
God
call.
bless you and your family. So
Well,
here we go.
It's kind of the
really
tide
wanting-
is turning today.
Yeah. But you know what, John? So we know that inflammation messengers increase blood flow to the area if you have an injury or trauma. I talk about that all the time. What we don't, and it also works if we have viral or bacterial infections. That's what we want. But man, when the inflammation goes haywire, what do we have? We have problems with our continuing problems with persistent what? We get stuck in the on position. In other words, the inflammation process gets stuck in the on position. It's like hitting the gas all the time. And what's happening is things may go undetected for a little while. You may just have some signs and symptoms of autoimmune disease. You may have some signs and symptoms of cardiac disease, but we really can't put our finger on exactly what's going on and what do we need to look for? Well, since 20 years has gone by, we can look for certain markers within the framework. This is something that I love to do. You know, I run very specialized traditional tests, meaning you can get this from the big labs. You don't have to can go on your insurance. These are the kinds of tests that we have to look at to help a patient and find out what particular inflammation markers are going haywire and where does that lead us in the sleuthing of a patient's challenge.
You were saying that there's good inflammation and bad inflammation.
Yes.
Can you explain?
Sure. Good inflammation is when we have a cut and it needs to heal up. And we know that the body's driving all of our markers, all of our blood cells to get there and, heal up the cut, right? Inflammation is when we have a bacterial infection or a viral infection or some other type of infection, fungus, for example. We know that the body is trying to fight that, and that is inflammation. But it's when the inflammation gets stuck on where something triggers it, and maybe it's because you're fatigued, maybe it's because you don't have enough of some of the substances we deliver in our hydration bags to help your own immune system really sort of straighten out and come back to balance, what I like to call Goldilocks theory, that goes haywires. And then what happens? It gets stuck on the on position. And man, do you have a problem? Do you have a problem?
It's like the car getting stuck with the gas pedal.
Correct.
You can't take the gas pedal off.
Correct. So think of inflammation as, and particularly chronic inflammation, as the engine that drives many of the most feared illnesses that we treat today.
Big Pharma called it the silent killer.
Well, actually, yeah, and what they did
Why
was,
is that?
Well, because you don't always find it in time, okay? We know that it actually can, again, it turns on by some type of thing. People think they have a genetic propensity for something. Just because you have the gene for a particular challenge, autoimmune, let's take my doc, MS, okay? She has MS. Maybe she has the genetic marker for MS, but did that mean it had to turn on? No, I don't think so. I think it turned on because she had other persistent types of problems. Remember, when you're working as an anesthesiologist, what kind of thing are you under? Stress. She had allergies. She had a poor diet because she was doing 10, 12 hours at the bedside or the table when they were doing surgeries. Don't you think that contributed to her MS?
Definitely.
Just because she had the gene didn't mean it had to turn on. And the fact of the matter is, we've helped turn it down. Right?
Yes.
Our clinic, actually, this is why she is my medical director. Our clinic helped turn it down because we were able to give her the types of, let's say, natural, as well as a subclinical dose of a regular drug to help turn that down. And as a result, she hasn't had to go on some of the more deadly immunotherapies for MS.
Boy, that's a great story.
It is a great story. It's a great story, and we're doing it for other people's. So how do we know how do we know you have chronic inflammation? Well, there are some tests we can do.
We'll pick that up. We're coming up on a break. Fascinating stuff.
Yeah, I could go straight through.
You're on a roll.
I could go straight through with
okay.
this. Okay.
It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We have a few minutes left of the show. You still have time to get in here, and if you have a question or a medical challenge for Dr. Molly, 855-839-1210 is the number, 855-839-1210. Dr. Molly and I are returning with more of today's Health Watch after these words. We are back here on Health Watch, operators standing by, and like we always say, they'll be there well after we leave you at 9 o'clock this morning In fact, they'll be there all day. 856-489-0505. That's the number. 856-489-0505. That's the number for Innovative Medical Associates, located in Marlton, New Jersey. You want to call and make that initial consultation, that appointment. It doesn't cost you anything. It's complimentary, and you'll really learn a lot about how Dr. Molly can potentially help you with your problem. 856-489-0505, and the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. It's Health Watch, Sundays 8 till 9 here at Talk Radio 1210 WPHT. We're going to the phones. We're going to talk to Eric in Exton. Eric, you're on with Dr. Molly. Good morning.
Good morning, Eric.
Good morning. I just woke up this morning not feeling good, and I'm waiting for Rite Aid to open up at 9 o'clock and so I can get a COVID test kit.
Good for you.
Hopefully it's not COVID, but I used to be up when, a couple years ago on what I was supposed to do, but I really kind of lost the bubble on what I should be doing. And I thought, well, I'll just call Dr. Molly. I don't know if he can tell me anything, but I'm hydrated, taking a lot of C, zinc, quercetin, iodine.
Sure. Yeah, you know that. You know the drill. It sounds like you're going to a good integrative doc. So yeah, you want to make sure that you're taking amounts of vitamin C. You want to make sure you're taking the quercetin. You want to make sure you're taking the zinc. You might want to now listen. And if you're really not doing well, I want to caution you that you want to get this test in. But again, you want to make sure that if you need a particular pharmaceutical, of course you have to take it. Okay, Eric? You don't, depending on how bad you are. But if you think you've managed this before and you got through it, everything I'm reading said this is a little less deadly than the original. But again, this depends on a lot of variables, But I would urge you to continue to take all of your supplements that you were taking. And see, in there lies the rub, Eric. We probably should all take a lesson out of this, because we should all be taking all these supplements right now through flu and the virus season that we're in. Because what happens is we get complacent and then we stop taking our supplements. And what do you think happens? We lose our reserve. And that puts people right back in my chair. So, that's a good thing. Start taking them and get over to Rite Aid or I'm sorry, CVS or whatever, and get your kit. Okay? God bless you.
Great.
And
thank you.
God bless you.
Thanks for the call.
Yeah.
Let's take Chuck in Westchester. Chuck, good morning. Welcome to Health Watch. You're on with Dr. Molly.
Hi, Chuck.
Hi, Dr. Molly. I have a question. I'm 85 years old. And
85 years young. 85 years young. All right. Yes. Go ahead.
But I have neuropathy, and both of my feet are tingling and so on, and pretty numb.
Oh, boy.
Do you have any suggestions?
I have several suggestions. Let me ask you this. I want to get a little more understanding. Do you have diabetes by any chance?
No, I do not.
Good.
The only medicine I take is for high cholesterol and heartburn.
Yeah, those were my next things I was going to ask you. So have you had Doppler studies on your legs, and is the blood flowing at what we would consider normal amounts at this point?
Yes, I've had
Good.
I forget what you call it.
That's good. That's good. Okay, so you've had all that. All right. Are you taking any supplements right now, like alpha lipoic acid?
No, I'm not.
Okay, you should look at alpha lipoic acid. And who's treating this right now? Is this your primary care doc or anything?
My primary doc has actually I am on gabapentin, but I know that that does nothing more than mask it.
Yes, you're right on. I tell you what, you're a perfect candidate. I know that you're a perfect candidate for our clinic. I have a lot of patients with the neuropathy. We also use radio waves as well on the affected areas, but we have to do this in twofold because we want to open up the vessels. I'd love to see those Doppler studies you have. We want to open up the vessels, make sure you're getting enough blood flow. The other thing I would want to do is I would want to run some testing to see if we have some inflammation that we're missing in somewhere, including the gut, since you're having the heartburn. Do you take probiotics and enzymes at meals or anything, my friend?
No, I do not.
Oh, I would start the probiotics too because I don't like that heartburn. And there's a couple of other things. I would run some other tests to see where possibly this inflammation is coming from, and check this all out. One of the things I would do. You sound like you're a very intelligent guy, and you sound like you're in good shape otherwise. And it's terrible to have this neuropathy. Alpha lipoic acid, glutathione as well.
Okay. Chuck, thanks
you
for the call. We appreciate it.
Very.
You want to wrap up? I know
Yeah.
we've got a couple minutes left.
Well, I want to wrap up by saying something like there are testing that we can do to really hone in on what particular type of autoimmune dysregulation you may have, whether it's a vascular problem or we're looking at things like POTS, which can be nerve problems. That's another thing I would want to do. For this gentleman, I would want him to go out and get some autogenic testing. But there's so many things that we can do for this inflammation, and I think it's very important that people go to a medical facility, have the testing done. That's the kind of thing my docs love to order. We will get it done for you, and then we can put together a great plan. In the meantime, though, I can still give them relief while we're waiting for these tests.
How do people know if they have inflammation or if it's good or bad or what?
Well, they'll know because they will have some of the underlying problems that we've seen before. Just like this gentleman, he has neuropathy in his feet. You may have gastric problems. You have digestive problems. This thing runs the gamut, John. And the problem is, until we can get that inflammation down and get it back to homeostasis, which is Goldilocks, just right, you're going to have this. You can have cardiovascular disease. I want you to realize that there are risks. High cholesterol is one of the risks. High cholesterol, high blood pressure. We really need to look at this. And, of course, diabetes and these comorbidities. All of these things can trigger this inflammation.
And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now at Innovative Medical Associates, and they will be there well after we leave you at 9 o'clock. 856-489-0505, 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Barbara, Lana, Donna, Vicky, and Daniel. And then, of course, there's Joanne, Delightful D, Fabulous Fran, and our medical assistant, Sandra. I'm your host, John DeMasi. Thanks for listening. Have yourself a great week. We'll talk to you next Sunday, Health Watch, 8 till 9, here on Talk Radio 1210 WPH.D. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.